Healthcare assistants support nurses, doctors, and other healthcare professionals by helping patients with daily tasks like bathing, dressing, eating, and mobility. They also assist with basic medical duties such as taking vital signs, maintaining patient hygiene, and keeping care environments clean and safe. In today's video, we explore 27 healthcare assistant interview questions and answers. Each answer can be customized to highlight your unique qualifications and experiences. Before your interview, be sure to research the company and review the job description so you can include key skills relevant to the job role in your answers. Let's explore some general healthcare assistant interview questions. Question number 1. Can you tell me about yourself and your previous experience? This is usually one of the first questions asked in a healthcare assistant interview. Hiring managers use it to get a quick summary of your background, how confident you are speaking about yourself, and whether your experience or attitude lines up with the job. It's also a way to see how well you understand the role and what you believe you bring to the team, whether that's past experience or personal qualities like compassion and reliability. If you have previous experience working as an healthcare assistant, you can use the following answer in your interview. I've been working as a healthcare assistant for just over 3 years, mainly in a residential care home setting. My responsibilities have included supporting patients with personal care, helping them with mobility, assisting with meals, and keeping detailed care records. I've also worked closely with nurses and families to make sure each person gets consistent, respectful care. What I enjoy most is building relationships with the people I care for. I believe it's not just about helping physically, it's also about being someone they can trust and feel comfortable with. I've been told I'm a good listener, and I try to bring patience and calm into everything I do, even on the busiest days. I'm now looking for a new opportunity where I can keep growing and be part of a supportive, team-focused environment. I'm really drawn to your organization's reputation for putting patients first, and I'd love to contribute to that kind of care. Next, here's a perfect answer for someone with limited experience as an healthcare assistant. While I haven't worked formally as a healthcare assistant yet, I've always been drawn to roles that involve helping and supporting others. I recently completed my care certificate and gained hands-on experience during my placement at a local care home, where I assisted with personal care, meals, and mobility under supervision. That experience confirmed for me that this is the right path. I felt really connected to the residents and motivated by the difference small acts of kindness can make. Before this, I worked in customer service, which helped me build strong communication skills, patience, and the ability to stay calm under pressure. I'm used to being on my feet, working as part of a team, and solving problems in real time. Now I'm looking for a healthcare assistant role where I can keep learning, build more hands-on experience, and be part of a team that puts compassion and dignity at the heart of care. I'm committed, eager, and excited to get started. Question number 2. What do you know about this organization? This question shows whether you've done your research and understand the values, services, and reputation of the organization. It helps the hiring manager see if you're genuinely interested and if your values align with the workplace culture. They're looking for someone who's not just looking for a job, but wants to be part of their team. I know this organization has a strong reputation for delivering compassionate, patient-centered care. From what I've read, you place a lot of focus on dignity, respect, and teamwork, which really stood out to me. Your commitment to high standards in both clinical care and emotional support really lines up with the kind of environment I want to work in. I also noticed that you've been recognized for staff development, and I think that says a lot about how you treat your team. The fact that many of your HCAs stay long-term tells me that this is a supportive place to grow. I'd be proud to be part of a team that takes pride in patient safety, values good communication, and goes the extra mile for people in need. That kind of atmosphere motivates me to do my best every day. Question number 3. Why did you decide to become a healthcare assistant, HCA? Hiring managers want to understand your motivation for choosing this path. They're looking for someone who values care, connection, and responsibility. It's not just about skill, it's about heart. I decided to become an HCA because I've always been someone who enjoys looking after others and making a difference in their day. I used to help care for a relative who had mobility issues, and that experience really opened my eyes to how much the little things matter, whether it's offering a kind word or helping someone feel clean and comfortable. That led me to look into healthcare roles where I could do meaningful, hands-on work. Being an HCA is rewarding because you get to support people both physically and emotionally. I like that I can build real relationships while also helping with important day-to-day tasks. It's a role that keeps me grounded and gives me purpose. I know it comes with challenges, but I feel like those challenges are worth it when you know you're making a real difference in someone's life. Question number 4. What skills does an HCA require to succeed? This question helps assess whether you understand the demands of the job. They want to know you've thought about what it takes, not just technically, but emotionally and socially. I think a successful HCA needs a mix of patience, empathy, attention to detail, and good communication. You're working closely with people who may be vulnerable, in pain, or confused, so being able to stay calm and kind really matters. It's also important to follow instructions carefully, especially when working alongside nurses or supporting medical routines. You need to notice when something's off, whether it's a change in someone's mood, appetite, or physical condition, and speak up when needed. Teamwork is a big part too. You have to work well with others and be willing to jump in wherever you're needed. At the same time, being respectful of patients' dignity and privacy is non-negotiable. For me, it's about being dependable, willing to learn, and always putting the patient first. Question number 5. What are your long-term career goals? They want to know if you're thinking about your future and whether you plan to grow within healthcare. It shows motivation and helps them see how committed you are to the field. My long-term goal is to stay in healthcare and keep developing. Right now, I'm focused on being the best HCA I can be, getting solid experience, learning from the nurses I work with, and building confidence in different care settings. In the future, I'd like to explore the idea of becoming a nurse, or maybe specializing in areas like dementia care or palliative care. I know it takes time and I'm not rushing it, but I enjoy learning and growing. I'm someone who likes to feel useful and know that I'm contributing to something important. So, whatever direction I go in, I know I want to stay in a caring role where I can support others and make a difference. Question number 6. Can you describe what you consider to be your weaknesses? This is about self-awareness. They're not expecting perfection. They want to see how honest you are and whether you take steps to improve. I'd say one of my weaknesses is that I sometimes try to take on too much myself before asking for help. I like to be helpful and get things done, so there are times when I've stretched myself a bit thin without meaning to. But I've realized that teamwork is just as important as hard work. I've started making a point to speak up earlier when I need support, and it's made a difference. I've learned that sharing tasks helps everyone, and it doesn't mean I'm not doing my part. It just means I'm working smarter. Being open about that has helped me grow, and I continue to remind myself that it's okay to ask for help when things get too busy. Question number 7. What are your strengths? Hiring managers want to know what value you'll bring to the team. They're looking for traits that fit the role, like reliability, empathy, and communication. I think one of my biggest strengths is being calm and reassuring, especially when someone's upset or anxious. I know that a quiet, steady presence can make all the difference in a healthcare setting. I'm also very dependable. I show up on time, follow instructions carefully, and always try to go the extra mile to help out. I take pride in noticing the little things. If someone seems off, if a routine needs adjusting, or if a patient just needs someone to talk to, I don't see care as just ticking boxes. It's about noticing and responding in the right way. I am also a strong team player. I believe that healthcare is never a one-person job, and I'm always happy to support my colleagues. Question number 8. Why do you want to work in this position? This helps them understand what's driving you toward this particular job. They want to know you understand the responsibilities and are genuinely motivated by the work. I want to work in this position because I enjoy providing hands-on care and supporting people through difficult times. Being an HCA lets me do that in a very real and meaningful way. I've always felt drawn to roles where I can make others feel safe, comfortable, and heard. This role gives me the chance to be part of a team that puts people first, and that's something I really value. I know the work can be challenging, but I also know how important it is. Even helping with small tasks like helping someone eat or listening to them when they're anxious can make a huge difference. I want to be in a role where I feel like I'm doing something useful every day, and this job gives me that opportunity. Before we continue, I just want to take a moment to thank you for watching this video. You can download a copy of these interview questions and answers in PDF format by clicking on the link below and supporting my channel by making a minimum donation of $3. Your support allows me to keep creating valuable content to help you pass your interview and land your dream job. Thanks for your support and appreciation. Question number 9. How does this role fit into your career path? They want to see if the role aligns with your long-term goals and whether you'll be committed. It shows whether you've thought things through and see this as more than just a short-term job. This role fits perfectly into where I see myself growing in the healthcare field. Right now, I want to build strong, real-world experience as an HCA, supporting patients, working with nurses, and learning the day-to-day rhythms of care. It's important to me to start with a solid foundation before moving into more advanced roles, and I see this position as a way to do that. Over time, I'd love to develop into roles with more responsibility, like senior HCA or training new team members. If the opportunity comes up, I may also look into further qualifications in nursing, but for now, I'm focused on giving my best in this role, learning as much as I can, and being a dependable part of the care team. I see this as a real stepping stone and a chance to grow. Here are some healthcare assistant interview questions based on your background and experience. Question number 10. What skills can you bring to this role? Hiring managers want to see if your strengths match what's needed day to day: compassion, teamwork, attention to detail, and resilience. They're also looking for how well you understand the job and how your personality fits the role. This question helps them picture you as part of the team. I'd say one of my strongest skills is communication. I know how important it is to listen, explain things clearly, and help patients feel safe and heard. I'm also very organized and good at managing routines, whether it's preparing meals, helping with hygiene, or supporting mobility. I work well under pressure and don't panic when things get busy. I stay focused and do what needs to be done. I'm a team player too. I've always believed in supporting my colleagues, checking in if someone's falling behind, and being reliable so others can count on me. On top of that, I bring a lot of patience and empathy. I don't just look at tasks, I try to see the person and what they might be feeling in that moment. I think those qualities really matter in this kind of role. Question number 11. What do you consider to be your area of specialty? This question helps employers understand where you're most confident and what you're passionate about. It's useful for placing you in the right setting, whether that's working with the elderly, palliative care, or dementia support. It also gives insight into where you may want to grow. My strongest area is dementia care. I've worked with several patients at different stages of dementia, and I've learned how important it is to be patient, calm, and consistent. I focus on building trust, using clear and simple communication, and keeping routines familiar so patients feel safe. One thing I found helpful is using music or old photographs to spark memories and bring a bit of joy into their day. I know those moments won't fix everything, but they often bring comfort or a smile, and that means a lot. I also make sure to support families who often feel overwhelmed. Just giving updates, listening, or sharing reassurance makes a difference. I feel confident in this area, and it's something I care deeply about. Question number 12. What types of medical equipment and techniques are you comfortable with? Hiring managers ask this to assess your hands-on ability with the practical side of care. They need to know you can safely and confidently assist with daily procedures, use basic equipment, and support the nursing team. It's about ensuring you're not just caring, but competent too. I'm confident using equipment that's part of day-to-day personal care, like hoists, slide sheets, commodes, and mobility aids. I always make sure I follow manual handling guidelines and ask for help when needed. Safety comes first for both the patient and the team. I've also taken blood pressure readings, monitored blood sugar levels with glucometers, and helped with wound care under supervision. I understand the importance of cleaning equipment properly and making sure it's stored correctly to avoid cross-contamination. In terms of techniques, I'm used to turning and repositioning patients, helping with feeding through PEG tubes, and recording observations like temperature and oxygen levels. I'm always happy to ask questions if I'm unsure and want to keep learning as I go. Question number 13. What experience with personal care do you have? Personal care is one of the core responsibilities for HCAs. Employers ask this to check that you're comfortable supporting patients with dignity and respect, especially in vulnerable moments. They also want to hear how you approach it with empathy and professionalism. I have experience supporting patients with all aspects of personal care, including bathing, toileting, dressing, oral hygiene, and continence care. I always make sure to approach these tasks respectfully, preserving the person's dignity and making sure they feel safe and in control. I understand that everyone has different preferences, so I always ask how they like things done and try to create a calm and private environment. Whether it's helping someone start the day or get settled in the evening, I take my time and keep communication open. There have been moments when patients felt embarrassed or upset, and I've learned that just talking to them gently, being patient, and giving them time can make a big difference. Personal care isn't just physical, it's about emotional support too. Question number 14. What continuing professional development are you pursuing? They want to see that you're proactive about learning and growing in your role. Healthcare changes all the time, and HCAs who stay up to date with best practices are more valuable to the team. It also shows long-term commitment to the field. At the moment, I'm working through some CPD modules online, including updates on infection prevention, dementia awareness, and end-of-life care. I make it a point to refresh my training in safeguarding and manual handling every year, even if it's not required. I recently completed a short course in mental health first aid, which gave me a better understanding of how to spot early signs of distress or anxiety in patients. It's helped me be more sensitive in day-to-day interactions, especially with patients who struggle to communicate. I'd like to continue developing in areas like palliative care and nutrition support. I enjoy learning new things and applying them on the job. It helps me grow and do the best I can for each person I care for. Question number 15. What are your educational aspirations or goals? Hiring managers ask this to understand how motivated you are to grow in the healthcare field. They want to see if you're thinking about the future, whether that's improving as an HCA or working toward further qualifications. It helps them gauge long-term potential and fit. I'd really like to continue growing in healthcare. At the moment, I'm focused on being the best support I can be as an HCA, but long-term, I'm interested in training as a nurse. I know that's a big step, but I've always enjoyed learning, and I'm passionate about patient care. Right now, I'm looking at part-time health and social care courses to build up my qualifications while continuing to work. I believe that gaining more clinical knowledge will help me understand the why behind the care we give and improve the support I offer to the wider team. Even if I don't go straight into a nursing program, I'm committed to keeping my skills up to date and finding ways to grow in the role. Every bit of learning adds value. Question number 16. Are there any areas where you feel you could benefit from further training? This question reveals self-awareness and your willingness to improve. Hiring managers don't expect you to know everything, but they do want to see that you can reflect on your experience and seek out opportunities to grow. I think one area I could benefit from more training in is supporting patients with complex mental health needs. I've had some experience, and I always aim to be calm and supportive, but I know there's a lot more I could learn about recognizing behaviors and responding in the right way. It's something I'd like to get more confident in because mental health comes into play in so many aspects of care. I'd also be open to shadowing more experienced staff or doing refresher courses in this area. I believe it's important to ask questions and admit when you need more support. That's how you keep learning and giving the best care you can. Question number 17. What would you say is the most challenging aspect of being an HCA? They want to see if you understand the realities of the job and whether you're prepared to face difficult situations. Hiring managers are looking for emotional resilience and practical thinking, especially in a role that can be physically and emotionally demanding. For me, one of the most challenging parts is when you grow close to a patient and then they pass away or their condition changes suddenly. You try to stay strong for the family and the team, but it does take an emotional toll. Over time, I've learned to manage it by focusing on the care we gave and the comfort we brought to the person in their final days. I talk to colleagues and debrief when needed, which really helps. It's part of the job, and while it's never easy, I think it's what makes the role meaningful too, being there for someone when it matters most. Question number 18. How do you approach patient confidentiality? Patient confidentiality is a legal and ethical responsibility. Hiring managers ask this to ensure you understand how to handle personal information, respect privacy, and follow policy without exception. I take patient confidentiality very seriously. I know that any personal or medical information shared with me must stay between the patient and the healthcare team. I never discuss patient details outside of work or with anyone who isn't directly involved in their care. If a family member asks something I'm unsure about, I politely explain that I can't share that information and will check with the nurse in charge. I also make sure to keep written records secure and avoid talking about patients in open areas. Respecting someone's privacy is a key part of treating them with dignity. It builds trust and keeps us all accountable. And finally, here are some common advanced and behavioral healthcare assistant interview questions. Question number 19. Tell me about a time that you dealt with a difficult patient. What was the outcome? This question helps hiring managers understand how you stay calm, compassionate, and professional when faced with challenging behavior. They want to see how you de-escalate situations, whether you can set boundaries, and how you prioritize patient care even when it's not easy. They're looking for strong emotional intelligence and communication skills. There was a patient on the ward who refused help with washing and medication. He was often short-tempered and didn't want to engage. I approached him gently each morning, introduced myself, and gave him space while also reassuring him I was there if he needed anything. Eventually, I asked if he'd like to choose the time for his care, and that seemed to make a difference. He told me he felt like everything was out of his control, and giving him some choice helped rebuild trust. From then on, he became more open to support. I always let the team know what worked so we could stay consistent with him. It reminded me that being patient and understanding people's emotions can go a long way. Every patient has a reason for how they act, and it's part of our job to help them feel seen and heard. Question number 20. Tell me about a time that you took the initiative as an HCA. What was the outcome? What did you learn? Hiring managers want to see if you go beyond just what's assigned. They're looking for people who notice problems, take action safely, and make things better for patients or the team without always needing direction. It also shows you take responsibility and are confident in your role. During a night shift, I noticed a patient who'd recently had surgery seemed uncomfortable and was slightly restless. The observations were normal, but I felt something wasn't right. Rather than waiting, I escalated it to the nurse on duty. She assessed the patient and found their pain relief was wearing off earlier than expected. Because we caught it early, the nurse was able to adjust the care plan and the patient settled again. I documented everything and handed it over to the day team. What I learned is that trusting your instincts is really important, even if you're not 100% sure what's wrong. We see our patients all day and night, and often we notice small changes others might not. Taking initiative doesn't mean overstepping. It means speaking up when something feels off so the team can work together to keep people safe. Question number 21. Tell me about a time that you communicated effectively with a patient's family. Families often feel anxious or emotional, and HCAs play a key role in providing clear, compassionate updates. This question helps the employer see how you balance professionalism with kindness. They're checking if you can build trust, maintain confidentiality, and be supportive while staying within your role. I once cared for an elderly patient whose daughter visited daily. She was often anxious and had lots of questions, especially about mobility and meal routines. I made sure to greet her warmly each day and provide updates on what I'd observed, like how her mom was eating or how far she'd walked. When she had medical questions, I reassured her that I'd pass those on to the nurse. By keeping that open line of communication, she felt more involved and less worried. One day she told me it meant a lot just to see familiar faces who cared. It reminded me how important communication is, not just for the patient, but for their loved ones too. Families want to know their person is safe and cared for, and a few moments of kindness and clarity can really make a difference. Question number 22. Tell me about a time when you worked with other healthcare professionals. Healthcare assistants are part of a larger team that includes nurses, doctors, physios, and more. This question helps hiring managers see if you're a good communicator, respect professional boundaries, and understand the value of teamwork in delivering safe and effective care. During a particularly busy shift, a nurse asked me to assist with a patient who needed help transferring from the bed to a chair after surgery. I worked alongside a physiotherapist who wanted to assess the patient's mobility at the same time. Before we started, we discussed the plan and made sure we were both clear on our roles and the patient's needs. We worked together to keep the patient safe and supported, taking our time and encouraging them throughout. The transfer went smoothly, and the physio appreciated how I kept communicating during the process. That experience reminded me how important clear, respectful teamwork is. Everyone has a role to play, and when we share information and listen to each other, we provide much better care. Question number 23. Can you tell me about a situation where you reflect on how you would have improved? Hiring managers want to see that you're self-aware and open to learning. Reflection is a key part of working in healthcare, and this question shows how you grow from mistakes or missed opportunities. During my early days in care, there was a shift where I got flustered trying to manage multiple tasks at once. I ended up forgetting to document fluid intake for one patient, which I remembered only after handing over to the next shift. I felt disappointed in myself because I know how important that record is for patient monitoring. Afterward, I took time to reflect and realized I needed a better system to stay on top of everything. I started keeping a small notepad during shifts and cross-checking tasks before handover. I also made it a habit to check in with the nurse mid-shift just to stay aligned. Since then, I've become more organized and confident, and I don't let the pressure of a busy day affect the quality of care or documentation. Question number 24. What steps do you take to respect patient privacy and dignity? Respecting privacy and dignity is a basic, non-negotiable part of care. This question tests your understanding of personal boundaries, your professionalism, and whether you truly value the human side of your role. I always treat patients the way I'd want a loved one to be treated, with respect and care. For example, I make sure to knock before entering a room, explain what I'm going to do, and ask permission before providing personal care. Even small things, like making sure a patient is properly covered during washing or asking if they'd prefer a male or female staff member, go a long way. I also make sure to protect their privacy during conversations. If I need to talk about their care, I do it quietly and in private when possible, not in the hallway or in front of others. Preserving dignity isn't just a task, it's a mindset. It's about seeing the person first and remembering that even when someone needs help, they still deserve control, choice, and respect. Question number 25. Tell me about a time that you dealt with a high-pressure situation in the workplace. In healthcare, things can change quickly. Managers want to know if you can stay calm, think clearly, and take appropriate action during stressful moments, especially when patient safety is involved. One afternoon, we had a patient fall in the corridor. I was nearby and responded straight away. I stayed with them, kept them calm, and made sure they didn't move while another staff member called for help. I monitored their breathing and kept them talking until the nurse arrived. Once the patient was safely assessed, I updated the incident log and stayed to help complete the observations. It was a stressful moment, but staying calm and focused made all the difference. That experience reminded me how important it is to know the protocols, work as a team, and not let panic take over. Even in high-pressure moments, patients look to us for reassurance and safety, and that's what I try to provide. Question number 26. How do you manage stressful or emotional aspects of this work? Healthcare can be emotionally heavy, and burnout is a real concern. Employers ask this to see if you're emotionally aware and have healthy ways of coping with the challenges of the job. I think it's really important to acknowledge the emotional side of this job. Some days are harder than others, especially when a patient is upset or unwell. I manage stress by staying connected to the reason I'm here, to care, to listen, and to support. When a shift has been tough, I take time after work to decompress. Sometimes I'll talk to a trusted colleague about what happened or write in a journal to clear my thoughts. I also make time for rest and things I enjoy, whether it's going for a walk, watching a film, or just having a quiet moment to myself. I've learned that looking after myself helps me show up better for others. It's not always easy, but it's part of the job, and I try to take each day one step at a time. And finally, here's the last question. Question number 27. Do you have any questions for us about this position? This shows whether you've thought seriously about the role, and if you're thinking ahead to how you'd fit into the team. It's also your chance to show interest and initiative. Yes, I do have a few questions I would like to ask you about this position. I'd love to know what support is in place for HCAs during their first few weeks. Do you offer shadowing or structured training to get settled in? I always want to be sure I'm doing things the right way and feel supported when starting somewhere new. I'd also like to know how the team works together during busy shifts. Is there a routine for handovers or a system that helps everyone stay on track? And if there's time, I'd be interested to hear what you enjoy about working here. It's always helpful to understand the culture and how people support one another day to day. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.